Hi, I'm doing my video on burns, pediatric burns to be specific. Burns can be dealt with any age group, but they're a primary main cause of injury towards adolescents. Burns are the second leading cause of death in ages 1 to 4. And any kid from 6 down, it has the highest risk of burn injury. 15 to 30% of all serious burns are caused by child abuse cases. Burns can be in child abuse anywhere on the body, but mainly seen on arms, legs, neck, face, and also cigarette burns are a leading cause too. There are many degrees of burns. First degree, superficial burn. Second degree, third degree, and fourth degree. First degree is called a superficial burn. It's where you have redness, pain, and swelling, but no blistering of the skin. Second degree is a partial thickness burn through the epidermis and the dermal layer, which you'll have redness, pain, swelling, but blistering does occur. It's hard to differentiate between the two of these, first and second degree burns, because blistering doesn't occur immediately after a burn. Third degree burn is a full thickness burn, a burn that goes through the epidermis, the dermal, subcutaneous, and the muscle and connective tissue layers. These burns are not initially painful, but they are black, white, leathery tissue, which are charred and leathery looking. But they are non-painful until they start to heal. Fourth degree is another full thickness burn, but it's more deep. It goes typically to the bone and tendons. But again, there is no pain because the nerve endings are completely destroyed, along with the hair follicles and sweat glands. There are many types of ways to be burned: thermal, chemical, electrical, and sunburn. Thermal is anything where you have a radiating heat, like from an engine, open flame, steam, hot coffee, or any other hot liquid. Chemical burns are any kind of chemical that you can have in a house. Drano, pool cleaner, metal solvents, any acid or alkalytic bases that are at far scales are bad for your skin. So even cement, mixed cement, is a chemical burn for your skin. Then there's electrical. Any open circuit or electrical socket that is powered on with live power can cause a burn. And then there's sunburn. That is not caused by thermal, chemical, or electric. It's caused by UV radiation. There are medications that you can use to help relieve some of the symptoms of these burns. Acetaminophen and ibuprofen are both used for first and second degree burns. Those are great painkillers for those, and also anti-inflammatories, but they won't work for third to fourth degree burns since they are such deep tissue damage. And that for those two, morphine is the prescribed and recommended dosing, but of course it has to be from a medical party like a doctor. If you ever do receive a burn, a minor burn, there goes first aid steps. You want to clean the area. You want to make sure that any material that is on fire and still burning you is separated from your skin. After that, you want to cover in tap water if available, or a bottled water if you have it close to you, to try and rinse the debris away from it. Dry it and wrap it in clean linen. Then see a medical advisor as soon as possible. That also goes with major burns, but you want to go along the same route, but it's a little bit more adamant just because it's such a deep tissue. And can cause, if there's anything more than 20% of the body, can cause shock to the body, which is definitely not wanted because it can lead to death. There are ways to prevent this. Simple, very simple, cost-effective ways. For thermal burns, keep your children out of the kitchen, away from pots and pans, open fires, and anything that will produce any kind of thermal radiating heat. With electrical outlets, keep your electrical receptacles covered. Watch your kid. Little kids are very apt to grabbing and putting metal pieces into these receptacles. Sunburns, simple. Keep a timeline on how long your kids are out there. Also, put sunscreen on, very cheap. And chemical. Make sure that you put them up out of reach, and locked up away from your kids. It's very simple techniques. All you have to do is follow them. Thank you very much.